You may have different plans that you're eligible for, but I want to walk you through just kind of a high level. I noticed on the call we've got several that are not yet eligible for Medicare, and so I kind of want to show you what you need to do, the steps you need to take, and really just overall give you some peace of mind to know that if I've got questions, I know where I can go to get an individual review of how Medicare and my state plan works for me. So let's jump in here. For those of you who are not yet Medicare eligible, you may have retired, you may have actually already started receiving your Social Security, but you may not be Medicare eligible. Medicare, you need to enroll in a 7-month window, 3 months before you turn 65, the month you turn 65, or 3 months after. You've got that window that you can enroll, your initial enrollment period. You take care of that through the Social Security Administration. They will take care of that for you. You must do this, even if you're receiving state retirement benefits and state retirement medical plans. You need to enroll for Medicare. Okay, so that's your time window that you have there, depending upon your age. Now, this is also out on the NCRGEA website. If you're a retiree, you have some actions that you need to take whenever you become Medicare eligible. So depending upon whether you are currently Medicare eligible or have a dependent that's Medicare eligible, depending upon when you retire, when you become eligible, you have certain types of paperwork that you're responsible for filing. Some of it is automatically enrolled. You've got 30 days prior to your benefit effective date to change a plan if you want to. So again, it's very, very important that if you're not already on your state retirement plan and you're just becoming Medicare eligible, that you take care of this paperwork beforehand. Joe's going to show you how that you can get a review of what that process is, and then we can, direct you how to get that taken care of. But it's so important that you do this within a certain period of time, because some of these things you're automatically enrolled in if you don't take it, but if you want another plan, you've got to do something different. So it's highly important that you do that. Okay. Now you hear Medicare, and then you hear, well, the state retirees get this plan, that type of thing. They're all different letters of the alphabet, and it seems like alphabet soup, that you need to decide when you want your coverage. Original Medicare is parts A and B. Everybody, and I'm repeating, everybody has to sign up for part A and part B. You've had premiums deducted out of your paycheck all your career for part A. So you sign up for that. There's no premium for that. Part B, there is a cost, again, for part B. Then you have to make the decision. Do I take the state offered plan if you're eligible? Again, some of you may not be eligible based on where you worked. Or then do I choose a supplement or a Medicare Advantage plan, and how does all that work? We're going to dig a little bit deeper into this, but just as very important to understand that no matter what plan, what route you choose, you have to have A and B first. Then all of the other coverages, the basic Medicare coverages, whether you go under a supplement, an Advantage plan, whatever that is, for your spouse, for yourself, doesn't matter who, they all follow Medicare guidelines. So whatever Joe Namath or Jimmy J.J. Walker says on TV about you can get money back from Social Security, all this stuff, the coverage doesn't change. Now, they may throw in some bells and whistles, silver sneakers, some things like that, but there are some things that you have advantage as well with your plans that you have available to you in North Carolina. Now, this is also on the NCRGEA website. I pulled this off because I really liked what it showed here. Depending upon your eligibility, again, depending on where you worked, if you work for the state versus county, city, that type of thing, you have 3 different plans. Some of these plans are free to you as the retiree, and then there's a premium for your spouse or for eligible dependents. Some you have a small premium yourself, but it provides more coverage for you. And then some is free, and then there's a premium for your spouse on a lesser plan in terms of reimbursement. Again, no matter what plan you select or whether you decide not to go with a plan, and I'm not advocating one way or the other, it's important that you do it for yourself personally. And that's why Joe and his team can help you, is to understand what your options are, how to make your decisions, when to make those decisions, and just know that the cost can vary depending upon the type of coverage, but the coverage or the covered events, the things that Medicare covers, will be the same on every plan. It may just be at a different rate. It may just be that you have some out-of-pocket expenses that go in there, but Medicare pretty much predicates what each one of these plans covers and will not cover. So let's kind of jump in and just understand. Again, everyone has to get A. That's what you've paid on all your life. You're going to get A. This is your hospital care, your skilled nursing facility care. I'm going to come back and kind of blow up that myth in just a moment, because it's really not what you think it is from that regards. Meals, general nursing, things like that, other hospital stays. What's not covered under Part A are doctor visits, anything for nursing home care beyond 100 days. I'm going to break that down in just a moment. Any type of private duty, anything personal, anything that you want to make your hospital stay any more enjoyable, Part A does not cover. So that's Part A, is really your hospitalization coverage. And then Part B, again, this is the one that you have to, again, enroll to the Social Security Administration. If you do this when you're eligible before you start taking your Social Security, they will bill you independently. When you become eligible for, or when you start taking your Social Security, you can take it out of there. You can change it, keep it out of your bank draft, whatever you want to. Part B covers your outpatient care, your physician's visit, home health, durable medical, and preventive equipment. It doesn't cover your prescription meds. Again, that's a different section, Part D. It doesn't cover skilled nursing, and that's a little bit different. When we talk about skilled nursing, say, for instance, one of you went and you slipped and fell during an ice storm. For someone to come to your home to provide recovery therapy to get you back on your feet, Part B does not cover that skilled nursing. Covered in different places. Dental, vision, hearing, hospital visits, those are not covered by Part B. It's more of your doctor's care, your outpatient care, and any type of preventative care that you have there. All right, so we talked a little bit about those life changes that maybe impact you. In 2022, your Part A, for pretty much everybody on here, because you all have worked long enough that you've retired with at least 40 quarters of work, again, that's zero. You've paid your premiums over the year, they've taken it out of your paycheck. Part A is there. You have a deductible for your hospitalization stays of $1,556 for each benefit period. Then, depending upon how long you're in the hospital, how long you need coverage for, or you need taken care of, there are co-pays, co-insurance pays that come out of your pocket. Then Part B premium comes in here. It's usually $170 a month. Okay, it could be higher depending upon you're a high earner, but again, that's why it's so important if you've had a life change to make sure that gets taken care of. But Part B, for the services that it provides, has a much smaller deductible and a smaller co-insurance clause. So that's basic Medicare, regardless of what you have through the state or don't have through the state. That's the basic Medicare and how it costs. And then what some people will do is they will take the state plan, or they will choose a supplement. Now, a supplement, depending upon your age, depending upon the spouse's age, I'm not encouraging you to turn down your state plan. I would encourage you to look at your options, because there's sometimes the state plans don't allow you to get back in if you want to jump back in and back and forth. But this is the alphabet soup that you talk about. And this is where, with the plans F and with G, oftentimes the plans that the state provides that you will hear on TV, things like that, these are the coverages that they offer within that particular Medicare supplement. And again, the Medicare supplement is a separate premium for you, separate premium for your spouse, anyone who's Medicare eligible, on top of your Part B coverage. So you can kind of see across there what it covers, 100% certain things. A lot of folks like that Plan F because it covers 100% of everything that's out there. May or may not be better than what North Carolina retirees offer for retirees. But again, just so that you know, so if you're sitting around at church, sitting around at a ball game, and somebody says, I've got an F, I've got a G, I've got a Plan N, this is really what it looks like. It's important, again, for you to understand what coverages you have through the state, what's available to you outside of it through Medicare, through a supplement plan, through an advantage plan, how that works. And that's why NCRGEA is hosting this conversation, so that you know where to go, and at least you have a a sense or a knowledge of what's out there and what you need to do. So to recap from an overall perspective, this alphabet soup, original A and B, you're responsible in Part A for a $1,556 deductible. In Part B is a much smaller deductible for your office visits. Medicare pays $80.20. Then your supplements come in, whether it is through the state, whether it is through an individual, whatever it is, will cover the Part A deductible. And then depending upon the type of plan that you select, you may have a $233 deductible with a Plan G. Plan G will then pay the remaining 20% copay, co-insurance clause, that type of thing. Bottom line, no matter what Joe Namath says, no matter what Jimmy J.J. Walker, Tom Selleck, all those guys that you're going to hear on the TV the next several months, all Medicare supplements cover the same thing on their internal benefits, no matter what provider or anything. They all use the same Medicare schedule. And this really can put you, one, in a good position because you know that it's the same, but two, it can put you in a little bit of a lurch because of what Medicare continues to shave off and change. And I want to talk a little bit about that. We talked about these cuts in Medicare. We talked about the hospital services cuts. We talked about skilled nursing cuts and things like that have been taking place. What Medicare has done is changed the way in which they provide services, not by saying we're going to not reimburse hospitals or we're not going to do this. They have changed how they reimburse for certain coverages based on the type of care you receive after you get out of the hospital, because that is a huge expense. And Medicare is not designed to really be recovery, home health, nursing home care at all. So here's how this looks for you. To give you an example, when I say they, Medicare has started reclassifying procedures that previous to 2021, say you went in for a knee replacement surgery and you spent 3 nights in the hospital. Well, Medicare prior to 2021 would have paid for rehabilitation services, things of that nature, while you got back up on your feet, whether it was in a skilled nursing facility or someone to come to your house. Every year they reclassify the procedures, meaning the procedure doesn't change. Medicare just says this is no longer an inpatient procedure. You still may spend 3 days in the hospital, but because Medicare has qualified it as an outpatient procedure or an observation status procedure, it means that there's no coverage for skilled recovery. You're responsible for finding that nurse to come to your house. You're responsible for paying for that. You're responsible if you have to go into a skilled recovery center to get care after the surgery. And really how this works out for you is this observation status change. It is simply a medical coding designation that hospitals use to bill Medicare. Medicare every year comes in and says, these procedures that were inpatient procedures, next year they're outpatient procedures, they're observation status. Still doesn't change the type of care you get, doesn't change the type of services you receive when you're in the hospital. You're still staying there 3 nights, you're getting your meals, all that kind of stuff, but you are in observation status now, qualifying you as an outpatient. And that means you don't receive those aftercare benefits that are so expensive and so important to you. So what happens is you go into the hospital and you're signing up all this kind of paperwork and you get shoved this form underneath your nose that says, this is an outpatient observation notice, that you're receiving outpatient services and you're not an inpatient because of X. And usually it's because Medicare no longer considers this procedure, a shoulder replacement surgery, a brain surgery, a skeletal surgery, something on your back, doesn't consider it as an inpatient procedure. And because of that, you don't receive the Medicare benefits after the fact. So Medicare hasn't changed what they cover. They just changed the procedures that fall into outpatient versus inpatient. And that can put a significant financial burden upon you. They give you this advanced beneficiary notice of non-coverage. Again, you're signing paperwork, you don't know what it means. Basically, it says if Medicare doesn't cover this procedure, you're responsible for it. And the way Medicare keeps their costs down is they go back and audit hospitals. They go back and they say, hey, you had too many readmittances for inpatient procedures. We're going to cut your funding, your reimbursement rate. Hospitals can't afford to lose their Medicare coverage. Therefore, they put this out here to their Medicare beneficiaries. And this doesn't matter if you're on the state plans, if you're on straight Medicare, Medicare supplements, Medicare Advantage plans. If Medicare doesn't qualify a procedure as an inpatient procedure, you don't receive those skilled nursing benefits after the fact. Now, when it comes to long-term care, there's this misconception that Joe and I see that people will say, well, doesn't Medicare pay for me to go into a nursing home? Doesn't Medicare pay for me to have services after I have a surgery? Again, we showed you how it depends, depending upon the inpatient, outpatient status. But for this situation, let's say that you are an inpatient, meaning that you spend 3 nights in the hospital, you're an inpatient, the procedure is qualified as an inpatient, and it's time for you to now go to a skilled nursing care facility. They're discharging you and they're going to take you somewhere that you can get rehabilitated, back on your feet, learn to toilet, feed yourself again, that type of thing. Medicare will pay 100% of that skilled nursing care for the first 20 days. Starting day 21, you will have a co-insurance clause, meaning you're responsible for $195, I think it's now up to $191 a day in 2022 for the next 100 days, or for the remainder of that 100-day period. After 100 days, if you still need skilled nursing care, or you're in a nursing home receiving some type of skilled care rehabilitative services, Medicare pays $0. And that is your responsibility. And so oftentimes what we see is someone has a fall, an accident, a procedure, something where they qualify for receiving the skilled nursing care. They get their procedure done in the hospital, go to a skilled nursing facility, get discharged and go to a nursing home to continue to receive their care. But the minute day 100 happens, they are 100% responsible. And unfortunately, they have to move back home. And a spouse takes care of you, or a son or daughter has to quit their job to take care of you. So there's this misconception that Medicare covers all this. Medicare does not cover true long-term care situations. They only cover a certain portion of it up to 100 days. So it's important to understand that there's a pretty big expense out there. So again, we talked about the level of care, the skill. Once you no longer need skilled care, meaning that you've recovered enough from your skilled nursing facility that you can walk, feed yourself, and all that, the payments stop. Whether it's day 20, day 5, day 19, day 91, Medicare stops paying for that 100%, and you're responsible for that expense. Nursing home stays, bottom line, are not covered by any type of Medicare coverage once you stop being either the 100 days or needing skilled care, which is having some type of rehabilitative services. So what that brings us up to is that if you're pre-65 and you still have state insurance, or you're post-65 and you have Medicare or Medicare supplement, or maybe the state plan, which is truly a Medicare supplement in your type of plan, you still have 4 major gaps. These 4 major gaps come in the areas of cancer, heart attack, and stroke. What we have found, if you have a cancer diagnosis, have a heart attack, or a stroke, roughly 60% of the expenses related to that trauma in your life are not covered by Medicare or private or state insurance. What that means is things like comfort items, anti-nausea drugs, wigs, prosthetics, transportation to and from the hospital and staying there for your chemotherapy, things like that. Living in Houston, I meet people all the time that are flying down to our medical center to receive world-class treatment. Medicare or your insurance doesn't pay for any of that travel expense. So again, there's some expense there that's pretty important. Medicare doesn't pay for medical transportation beyond a very small amount. And it could be 20% of what it costs for an ambulance or an air ambulance, a helicopter to transport you. Or Medicare, I've even seen sometimes will say, you know what, you could have taken an Uber to the hospital, or you could have had your daughter drive you. We're not paying for that ambulance ride whatsoever. So they don't pay for medical transportation in certain areas. Then we've talked about this whole concept of elder care. Medicare is not designed, wasn't built to provide any sort of elder care or any type of care that would take care of you after the fact that you need that. And then finally, it doesn't provide any type of life insurance after the fact. If you pass away and leave bills back to your spouse, something like that, Medicare does not have that type of coverage built inside of these, of any type of supplement plan, any type of state plan that you have that way as well. So there are some significant gaps out there that you have. The good news is, and this is why NCRGEA has partnered with AMBA, is to make sure that you have 100% knowledge of what your benefits cover, what they don't cover, what gaps are out there, and you can make the decision how you want to cover those gaps as well. So I'm going to ask Joe to unmute yourself real quick, Joe. While he's doing that, please let people know about these CAB discussions, these webinars that we have. This is a great way to introduce your friends to this education series. Let them know about the value the NCRGEA brings to them and how they can take care of all the needs that they have, whether it be a benefit question, fellowship with your fellow retirees, getting information that you need. So let them know about these educational webinar series. So I ask you to pull out your phone, grab your phone, and open up your smartphone to your camera feature. Take that camera feature and simply hover over that QR code, okay? Hover over that QR code, a little form will pop up, press that little box that pops up, and you can simply select, I want a benefit review, or I want to know more about Medicare, or I want to know more about long-term care or recovery care, something like that. Give yourself the peace of mind. Find out about the discount program that NCRGEA has for you through AMBA that can save you a lot of money as well. So again, take your smartphone, open up your camera, hover over, don't take a picture, hover over just like we do in restaurants these days. Hover over, a little box will pop up, use your finger, hit that, fill out that form, and Joe and his team will take care of you to make sure you've got that. If you don't have access to a phone, you're watching us on your phone, you're watching us on an iPad, you can simply email Joe Maddalon, JoeMaddalon at amba.info. And just say, hey, Joe, I was on the call today. I want a review of what NCRGEA has for me, how my benefits work and stuff like that. So Joe, you want to share, jump on and share what that benefit review conversation looks like after someone either uses the QR code or emails you?
Yeah, absolutely. John, thank you. Thank you. Great job. Great information. Hope everybody got some value out of it. I know every time I hear you speak, John, I'm always learning from you. So you do an amazing job. So we appreciate that. So yeah, again, Joe Maddalon, Regional Vice President. I will be working very closely and have been working very closely with your association. I am the benefits advisor, and I have a few of my advisors on the call as well today listening in. And we are here to support the membership. We are here to make sure that the members are taken care of, and we get the information to the members as they request that information. You will be seeing and hearing from us periodically. We will be hosting more of these informational meetings, but we're here from a member's perspective to support you when you have questions, when you have concerns. You know, Joe, what is covered, what is not covered? You know, where are those gaps? You know, what are the programs that the AMBA has partnered up with the association to be able to fill those gaps? You know, how do they pertain to me? Do I qualify for them? You know, those are the questions, and that's the resource that myself and my team will provide to members, and that's why it's important to be a member of the association. You get built-in business consultants, business advisors, just like we are, and we're here to support you and make sure that you make those informed decisions. You know, a lot of times we hear this for our retirees. You know, Joe, I was listening to the radio, or I saw this news article, or I heard one of the Joes on TV. Is it too good to be true? Are there things out there that I should be utilizing? And we'll take a look at your individual scenario, and we'll help you make those determinations and those decisions. And you can count on the fact that you know, Tim and the board and everybody that's you know, kind of partnered here with AMBA They put us in those positions to make sure that you get trusted advisors to help you make those decisions. So John, if you go ahead and click on that QR code, and me or my team will respond, and we'll help provide the resources, or will be the resources to help provide the answers that you need so you can make informed decisions. We're here to support. We're here to help. And then if there are some non-members that are on the phone, right? This is part of what your memberships are, right? You become a member, and then we're here to support you, and we're to provide those resources for you. So all those non-members that are on the Zoom call, it's another reason for you to be able to go ahead and join the association. So great job, John. Appreciate it.
Thank you, Joe. We had a couple of questions that popped through. Some of these are more specific to an individual, and that's why I can't stress enough to you using that QR code, emailing Joe, because everyone's situation is different, sometimes based on your length of service with the state, based on whether you're a city, county employee versus a state employee. So many different nuances that it's important that you understand exactly what Medicare does and doesn't cover. But there were a couple of questions that came in that I thought the whole group would like to know. One talked about appeals. There is the ability to appeal your Medicare decision, for lack of a better term. Most hospitals have someone that coordinates with that. I will tell you, hospitals are very, very delicate around that Medicare appeals process, again, because most of their funding sometimes comes from Medicare. They can get a significant chunk lopped off of their reimbursement rate if they don't do things right. But there is a process for that. Then there could be Medicaid options. What I've seen is that most state employees that have an active pension, meaning they're drawing a pension, usually don't qualify for Medicaid. Got to be some certain situations, things like that. So Medicaid is very difficult. Medicare and these supplements are important. And that's why it's like I said, you take control. You've got peace of mind whenever you know what your plans are and what's covered and not covered. And then one last question, again, use the QR code, email Joe, and ask, is the 21 days or the 20 days and the 100 days per event or for the life of the person? That's a great question, Ann. That is for the procedure or the event. That is not the life of the person. So if you slip and fall in your first ice storm and have to go into a care facility for 30 days, and then you get out, and then you have back surgery and have to go back in 2 years later, two totally separate events, have nothing to do with each other. It is for that specific event. But again, as Medicare changes all the time, what may have been a covered event last year, they could classify as outpatient and may not cover it this year. So two really good questions in there. Again, use this QR code, email Joe at joe.madelon@amba.info, and let him and his team answer any questions you've got. Cover your benefits, show you what you have available through your membership of NCRGEA. You're paying dues, you're a member. Find out why we partner with the best retiree associations to provide the best benefits for you as well. Find out what's out there for you. It's a great way to start a relationship. Daryl, I'm going to throw it back to you and stop sharing, but thank you very much for the opportunity. Ben and Bobby, thank you so much for allowing me to jump on your cab call, and appreciate it very, very much.
Good. Thank you so much, John. I have a couple of questions that have come up in addition to the one that Ann had, and one pertains to the vision and dental benefits. Are members able to sign up for that now, even if they didn't sign up before?
Are you talking about the dental and vision benefits through AMBA and NCRGEA?
Mm-hmm.
Absolutely. That's probably our most popular benefits, are dental and vision. You have the ability as a member of NCRGEA to sign up for your dental and vision benefits at any time you want to. Again, you can use that email address, that QR code, select that on there. There are a lot of different ways. So even if you got a letter from us and never responded, you can sign up at any time and be eligible almost immediately for that. So good question.
Okay, great. I have another one. I'm looking for it right now from Robin. And he said, I have heard of what is called a qualified plan. If we work for 30 years to get paid up health care, why can we not utilize that paid up policy and avoid Medicare?
Okay, great question.
Mm-hmm.
All right, because you have earned it. That is your qualified plan. you still have to get parts A and part B, and then your qualified plan, be it the state plan, whichever one of those three levels you choose, becomes your Medicare supplement, for lack of a better term, at that point. It's so important. Everybody over 65 has to get A and B. And then you've got your options, your alphabet soup options after that. If it's your state qualified plan, it doesn't stand alone. Medicare becomes primary. So say you're using that plan now and you're 63, 64. And then once you turn 65, Medicare becomes primary. You still keep the other plan that you have through the state. It's a qualified plan. So, okay.
Okay. Thank you for that. The next question is from Ms. Brown. What if I have VSP? And I'm not quite sure what that is, but you may know, or we may ask.
Okay. Yeah,
can I still get the vision plan?
Right.
And which one will be the dominant plan?
Okay, good question. VSP is probably one of the largest providers of vision care in the country. Large network, Walmart, Sam's, Costco's, individuals, all that kind of stuff like that. Depending upon the type of plan you have, some benefits may be more rich than others, but they don't coordinate, meaning that you don't really need two in there. The other side of that coin is, from a dental perspective, dental plans coordinate. You can double dip. So if you've got to have procedures that are more than either plan covers, you can double dip and get it covered that way. But there's no need to have two vision plans. Just pick the one which you like has the most benefits and use that one.
I think you may have alluded to this earlier regarding opting in and out of the state plan. I believe because I've opted out and I was thinking about opting back in, so we can opt in and out, during the enrollment periods for that one. I'm not sure about the state and local governmental plans are all, they're varied. So each person would have to find out from his or her organization or agency department what the requirements are for that.
Right. And Pat asked the question, why do we have to sign up for Medicare?
Yeah.
That's the universal question, Pat. I mean, it's one of those things where, like my dad always told me, it just is what it is, so that's just what we have to do. You've been paying into it. That's the manner in which hospitals and doctors receive their payments once you reach age 65, for the most part, regardless of whether you've got a state plan or not. So you've got to get parts A and part B. And then your state plan is the supplement, so to speak, in there. Again, that's why you've got Joe, you've got Bonnie on this call. You've got a resource of AMBA folks that can help you out understand all those questions. All that stuff that you may have heard in Sunday school when you're sitting around the coffee before the service starts, all the misconceptions there. My mom is the same way. She'll come and tell me this plan's better than this. I say, Mom, it's all the same, So all that misconception, that's what Joe and his team will do to resolve that for you. So I highly encourage you, send him an email. Joe, drop your email in the chat there.
Yeah.
Folks can have that.
Hey, John or Bonnie, can you go ahead and do that? My chat function has not been working, so I can't type into the chat function. So if Bonnie or John, if you could just go ahead and put that in there. So there's a couple of other questions too.
Yes.
That I think if you just click on that QR code, as far as the dental plans, we can send you the information via email. We can give you a holler as well too, as far as what those specifically look like. But yes, definitely use the QR code for some of those questions. But John, if you or Bonnie could go ahead and put my contact information in that chat, and I'm not sure why I can't type into the chat, but I'll figure that out later.
Okay. Well, there's Robin he said you answered his question about the qualified plan and our state plan functioning as secondary. How will we find out what our secondary plan will cover, therefore keeping us from buying double coverage?
Okay. Another great question. Because it coordinates, and when I say coordinates, meaning that your state plan knows the minute you're 65 and you're on Medicare, that Medicare becomes primary. Again, parts A and B, all that coverage becomes primary. The state plan becomes secondary to fill the gaps in there. So that's that trigger. That's that 65 age trigger that does that. There's not really anything. Now, again, I don't want to speak out of turn because I don't know what you have to do at the state level to make sure that that's connected together. But if you're on the state plan, they'll tell you, you've got to get your Medicare at age 65. It automatically becomes primary. The hospital is going to search that and then see that you've got the state plan. Say, okay, the benefits match up here. This covers the co-insurance. This covers the deductible, that type of stuff. So there's not really anything you have to do from that perspective. Deb said, I don't have a smartphone. Deb, I love you. I wish I didn't have one either. But if you just will email Joe or Bonnie in there in the chat, you see that, they can get you started with anything out there. Any questions that you've got, do it over the phone, do it via Zoom, that type of thing. Okay.
Did we get the question, if spouse is covered by purchasing their coverage through the state at 65, what happens to their coverage?
The same situation. At 65, it becomes, the state plan becomes secondary, Medicare becomes primary. There shouldn't really be any type of transition gap, because again, that state plan becoming secondary covers all the little holes that Medicare does, that type of thing. Okay.
We have a couple other questions, and I'm gonna read this one first, and I'm gonna go back to another one. How do you sign up? This is from Nancy, for Medicare. My window is coming up in a few months.
Everything like that is through socialsecurity.gov. SS, is it SSA or SSS?
SSA.gov.
SSA.gov. Okay, there we go. That's where you start the whole process.
And Nan is asking, if you have A and B and use state plan or supplement, but move out of NC to relocate, what coverage will coverage still be okay? Is it transportable, or if traveling, are we covered?
If you travel, you've got coverage. That's the beautiful thing about Medicare. It's really a great plan, even if you have the state plan on top of it. What I don't know, Daryl, and this is something that Joe and his team are, as we learn more about North Carolina, there may be certain plans that are PPO plans or HMO plans that really restrict you to the network in which is in that plan. So if you go out of the state and there's not network provided, then you may fall back on just regular Medicare. So again, that's a little bit of the nuance. That's why it's so important to have an individual conversation with Joe and his team to understand what your individual situation is. Other plans are pretty much wide open. You can go anywhere you want to, but with those state plans that are tied into the HMO or the PPO, they're much tighter bound in terms of network providers. But say if you're traveling and you have an emergency and need something, you're going to get covered. Don't have to worry about that.
Another question, does LG have a qualified plan? This is from Janice.
I'm not sure what LG stands for.
Janice, either unmute and let us know what that is, or put it in the chat.
Local government?
Local government. Okay.
Hey, Tim, you want to you want to answer that? I don't know if it's by city, by county, how they do that.
I'll probably need to get the full question, and then I'm probably going to do some research. But go ahead. What's the full question on it,
Daryl? Do they have a qualified plan like the state does?
Yeah.
Different. That's all. And that there are some nuances depending on the municipality. So that's probably a good one to call into you all. And then if we need to do some research back here, we can specifically.
Absolutely. Absolutely.
Yes.
We can sit down and decipher all that alphabet soup, see what is and isn't covered. And again, make sure that you have peace of mind. And that's what NCRGEA does for you. That's what your membership is for, to make sure that your retirement years, you put in all this time with the state, that, you know, that your retirement years are peace of mind and comfort, knowing that you've got the coverage you need, that you can face those financial situations as you go through there. So, okay.
We'll take one last question because our time is 3 minutes. We have 3 minutes. Spouse is paying COBRA full rate currently. At 65, would or does that rate of pay change?
You know what they say about assume, what that does? I think, however, it would change because your COBRA rates are astronomically high. Once you then go over 65, it would convert to the Medicare rate plus the supplement. I don't know what the state, do they provide anything for spouse coverage, or?
You have some options, I think. We'll have to get the Humana folks to really explain that so that we don't tell you anything that that just because we think it may be that way, but they will be having some sessions around the state, I believe starting sometime this month. This is September 1st. So you might want to go to the state health plan and look at the schedule, and they will offer some seminars, some webinars, and I think some in-person activities to help you understand all of that. So the next question was, yeah, and this may be a question from Stephen that we may need to have Humana answer. Would you please tell us how the state Medicare Advantage plan is superior to other Advantage plans?
Okay, that's a real good question. Again, this is where Joe Namath and Jimmy J.J. Walker are going to tell you their plan's the best. All the internal coverages, everything is the same. No matter whether you go with state plan, other plans, all the same what Medicare pays for. Where you may get bells and whistle coverage, some coverages may offer silver sneakers, an exercise program. Some may do something a little bit different with their prescription plan. So, I mean, there's little bitty nuances in there. Again, I cannot stress enough, email Joe, use that QR code, whatever it is. Let's research that for you. Let you make the decision, because that's gives you that knowledge and power back. Okay.
Absolutely. Someone said that the local government folks will go directly to Medicare once they're 65.
Basically, it means that there's not a plan similar to what the state offers. They would go straight Medicare and be required to purchase some type of a supplement at that point.
Right. Or is there a difference between supplement and Advantage?
Good.
Just terminology.
Again, it's terminology. Most Advantage plans lock you into a network of doctors. That's the biggest difference between the two.
Okay.
So for my mom, she's on an Advantage plan, but she goes within a 10-mile circus radius, and all of her hospitals and doctors are there.
All right.
You know.
So one of the last things is,
if I can hang on just a second, if I can jump in on the,
yes.
You know, when you're comparing your Medicare Advantage plans, you definitely want to make sure that, you know, your doctors and healthcare providers would be included. But then the other thing that JJ Walker and Joe Namath don't cover in their 30-second spots is there's always something called a maximum out of pocket. So that's one thing as we, you know, walk through and do your benefits reviews with each of you folks. You know, we look at that because sometimes what happens, your free plan, if you get sick and have to use your insurance, that free plan could cost you $3,000, $5,000, $10,000 if y'all go out of pocket. So when we sit down with folks, we make sure that, you know, you fully understand, you know, what you're looking at. So we help kind of translate that for you.
Yes. Thank you. And I have a note here that folks can also call our office and ask to speak with Josephine Lanier. She also works very closely with all of our benefits. And let me see if there are two more messages. If they, there's a difference. Okay. So thank you all, everyone. Ben, I think you're going to close us out. Thank you, John. Thank you, Joe. Thank you, Carl and Tim and Bonnie, Bobby and Ben for being with us today, and all of you from District 3 as well as District 6 and others. So Ben, if you want to close us out, that'd be wonderful.
Thank you very much. And I'll just echo and ditto the thanks that you have already given to everyone. This is an extremely valuable source for information. Us local government retirees have as many plans as jurisdictions. That includes a wonderful one like I have to folks who have nothing once they have retired from local government. In North Carolina, it is entirely up to the governing body of the jurisdiction for whom you worked from which you retired. So I used to be, among other things, the group plan administrator for the county where I worked. I used to know a whole lot, and now I know there's a lot I don't know. So many, many thanks to Joe and John. I encourage all of you to utilize their expertise. Any of you who are not members of NCRGEA, please consider joining us. We need you for our numbers, for advocacy and lobbying and assuring that we keep your benefits strong. And as you have seen from this presentation, you need NCRGEA. So Thank you very much for attending. Thank you very much, presenters. This is a great opportunity for retirees of local and state governments throughout North Carolina.
That's it. Thank you, everyone.